What is on your radar, Robby? I am dying to know.
Well, I'm dying to tell you. So the term FEDS has been trending on social media following the apparent revelations that Pfizer released the vaccines 2 years ago, despite not having any research suggesting they would actually prevent the spread of COVID. At a meeting of the European Parliament last week, Janine Small, who's a Pfizer executive, was questioned by Rob Roos, who's a Dutch Parliament member.
And I will speak in English so there are no misunderstandings. Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market.
This is scandalous. Millions of people worldwide felt forced to get vaccinated because of the myth that you do it for others. Now this turned out to be a cheap lie.
So Roos's tweet of that video has gone viral, was viewed millions of times. And I can see why many people, Roos included, see it as a startling admission. Governments and health authorities all over the world justified vaccine mandates on the grounds that they were necessary for public health. You had to get vaccinated not just to keep yourself safe, but to minimize the risk of transmitting the virus to others. If Pfizer had exaggerated the benefits of vaccination and misled the public, well, that would be a shocking, odious revelation. There's just one problem with that, and it's that vaccine makers never actually marketed them as preventing transmission of COVID. As the Associated Press notes in a fact check of Roos's post, the scientific study that was released the day before the FDA granted emergency approval to the vaccines found that Pfizer's vaccine was 95% effective at stopping symptomatic COVID illness in people 16 years and older. When asked whether the vaccine would prevent transmission, Pfizer CEO Albert Bourla said, "I think this is something that needs to be examined. We are not certain about that right now." Even the FDA conceded in its press release about vaccine approval that at this time, data are not available to make a determination about how long the vaccine will provide protection, nor is there evidence that the vaccine prevents transmission of SARS-CoV-2 from person to person. According to Pfizer, quote, stopping transmission was not a study endpoint. So the vaccines are extremely effective, to be clear, at preventing high-risk people like the elderly and the immunocompromised from contracting severe disease and dying from COVID. But they're much less effective at stopping transmission of the virus itself. They did keep case levels down somewhat for the original strain, but then the Delta and especially the Omicron variants quite capable of evading protections. By making severe disease less likely and reducing duration and severity of symptoms, vaccines do have some positive effect at reducing transmission, but it's clearly quite limited. Breakthrough cases of COVID are now so common, we all know someone who's had one if you haven't had one yourself, we've stopped actually referring to them as breakthrough cases. But again, the vaccine makers never claimed otherwise. So if you want to hold someone accountable for misleading the public and requiring vaccine mandates on public health grounds, you actually have to direct your fury at political figures who committed this error.
We don't talk enough to you about this, I don't think. One last thing that's really important is we're not in a position where we think that any virus, including the Delta virus, which is much more transmissible and more deadly in terms of unvaccinated people, the various shots that people are getting now cover that. You're okay. You're not going to get COVID if you have these vaccinations.
That was at a July 2020 town hall. Joe Biden saying something that's just not true. Now, I think it's important to keep in mind that Pfizer did not make the laws or announce the executive orders that forced vaccine mandates on employees, on students, on people entering the country, etc. These rules were formulated by government bureaucrats and political figures. One of the most sweeping U.S. COVID mandates, a vast requirement that 80 million employees of private companies get vaccinated, was issued by President Biden himself and no one else. That was later struck down by the Supreme Court, and rightly so, in my view. But the U.S.'s travel mandate, a requirement that anyone entering the country who's not a U.S. citizen be vaccinated for COVID on public health grounds, that's still in place. So my point is that people should direct their criticisms at the U.S. government. Mandates were government policies not enacted by Pfizer or anyone else. Hold our political leaders accountable if they continue to cling to policies on public health grounds that make no sense. And so that's my frustration, Amisha, because this went really viral over the last couple days, and it was as if something that we didn't know before had been conceded by this Pfizer executive. But actually, they never even made that claim, that claim was made wrongly by so many government officials, so many commentators. I probably made it wrongly at various times. All these people saying things that it turned out not to be true, but was not studied in the initial trial. And the reason it matters is because the mandates, I think, were largely justified on grounds that it was not just you should do what you're doing for your health. But we don't force you generally to live a more healthy life. The mandates were coming in because, it's not just you could get someone else sick and they could die, et cetera. But the vaccine itself helps prevent you from getting it. But we're going to make it so that you have to get it so I might not transmit it to you in a workplace setting, in a school, whatever. If it's not true that the vaccines really do all that much to stop person A from transmitting it to person B, the justification for having that kind of law kind of goes away. So that's why this matters so much. Because the public health justification for the mandates really rests not just on keeping yourself safe, but on keeping others safe, which we now know. Now we're okay. Now it's okay to admit, even though there were policies on social media and elsewhere that you couldn't say this, but now we all know it's basically true that the vaccine itself is not really doing the job in terms of transmission.
Well, I think that the vaccine is working like all vaccines do. So I take a little bit of honors with the clip that's been shared, worldwide, because I think that it furthers anti-vaxxer notions. But the issue here is that people are trying to make the COVID-19 vaccine, the Pfizer vaccine, work in a way that every vaccine in the history of vaccines has not worked. The idea that it was going to prevent you from getting COVID was never one that was pushed by doctors or actually Pfizer itself. Like every vaccine, the idea here is that it will help you if you do catch this highly contagious virus, that it will reduce long-term problems or reduce hospitalization. That is the key here. It reduced hospitalization numbers, and it has. It has done exactly what it was supposed to do. Now, if you want to argue that there were some state and local leaders who had various mandates. In Chicago, my hometown, Chicago, stay home, save lives. Basically, people were locked in the house for quite some time, to the point where there were actual patrols to see when you were outside. I thought that was a bit much. But I feel like, at least in the early onset of this pandemic, people didn't really know what to do or how exactly it was transmitted. So we heard a lot of things that became conflicting later on. Then there were all of the variants and subvariants that came out of this. And quite frankly, many people got frustrated because, again, knowledge of science in this country is pretty low. So you had people who assumed if I get vaccinated, then why the heck am I getting this virus? As somebody who was vaccinated, boosted, and just received the new booster, I've gotten COVID twice. Both times it was the newest variant. I never had Delta. I had the Omicron twice. And yes, it was not fun to have, but I assume because I know friends who didn't have the vaccine, whose symptoms were a lot worse and lasted longer than mine did. So with that being said, it operated in the way it needed to operate. I think we're always going to see these flash in the pale news cycles where people are still basically trying to shade the vaccine in and of itself. But if you're going to direct your upset at anybody, it should be at some state and local leaders. I think that were a little bit overzealous in their understanding of how it spread and how they treated it. As somebody, I was in New York last Christmas, and they had not only the vaccine mandates, they had the vaccine passports. You could not go anywhere without showing this. I got COVID in New York with a vaccine passport in an arena where everybody had the vaccine. So I think we have to be very serious. That's kind of how it worked. Granted, I wasn't, down, sick 4 days at a time, didn't have to take off work or anything. But it was one of those things where we have to be serious about what is happening here. If you tell people or they have an idea that because they have the vaccine or the booster, they'll never get COVID, I think that is an ignorant understanding of how this works.
Right, it's obviously just wrong.
Just like the flu vaccine. I've had the flu before and had the flu vaccine. There are various variants associated with that as well.
I got the flu vaccine, and I got the COVID vaccine, and I've gotten my booster, et cetera. I'm not against getting the vaccines at all. I just think it should be It's your choice whether to do. I mean, talk to your doctor. I'm not going to require anyone to do it because it's not stopping anyone else. The public health justification isn't there. Do it if you want to do it. Don't do it. Doesn't matter to me. And that's what I think government policy should reflect.
Well, we have a sizable elderly population and people in this country who are not elderly who have pre-existing conditions. Yeah. So for me, public health is ensuring that I'm not only taking care of me, but I'm also thinking about my fellow man.
Well, I think those people should get it. It just doesn't matter if I do or not.
I don't necessarily think that's true. I'm going to push back here because as somebody who has an aunt who's since passed who had cancer, I would not go around her without having a vaccination. Absolutely not. Yeah. Because at the end of the day, she could catch this and she could end up passing. I think that we have to be very serious about that. Obesity and being overweight in this country, that continues to increase, no pun intended. Those people have a lot harsher effects once they contract COVID than you or I would.
Oh, I don't disagree with that.
So we do have to be strategic about how.
And those people should get vaccinated. I'm just saying it doesn't matter whether I get vaccinated or not. Doesn't have much impact on whether they're going to get COVID.
Well, that study has yet to be seen.
Right.
We have yet to fully see whether this has actually reduced transmission rates.
Yeah.
Again,
a little bit,
the verdict is still not out on that.
I think it's a little bit, but maybe not that much. All right. Well, thank you so much for that spirited conversation, and we'll have more Rising right after this.